Very warm welcome from down under in Australia to all corners of the world. I'm Dr. Mark Wotherspoon to take a very different look at an old challenge, that is to provide professional oral hygiene instruction for our patients in the surgery so that they can better look after their removable dental appliances at home. And the backdrop is that the world is finally waking up to the direct link between oral hygiene, oral health, and general health. We do need to reflect on the very poor standard of dental appliance hygiene and ask ourselves, can we do better? And I know we can do better. We only have to look at the products and the tools that we've been recommending. They haven't really changed in over 50 years. And really this brush is just a funny little variation on a toothbrush with its long handle and small head, designed perfectly to clean teeth and gums inside the mouth, but not so well developed to wash and disturb biofilm with these slippery little odd-shaped pieces of plastic and metal, often held in our fingers over a bathroom vanity or hard bench. And after our patients or the parents of our patients have finished the task, they store their removable appliance in one of these tiny little sealed germ incubators. I know we can do better, we will do better. So let's now dive into providing professional oral hygiene instruction for removable dental appliances in under 60 seconds. Okay, let's get into this. So how to formulate our science-based dental appliance hygiene instructions? Well, we're going to have a look at what the research says about biofilm that is growing on the dentures and the sports mouth guards. We're also going to see what the research says about how well our patients are doing with their home care, and spoiler alert, they're not doing too well, and that this is directly impacting their general health as well as their oral health. We'll have a look at some dental and non-dental industry recommendations, what our profession is saying, and you may be shocked as I was as to learn how mixed these messages actually are. And we'll then move on to the science and finally pull all of these recommendations together to come up with our chairside oral hygiene instructions that our patients can easily understand and easily follow and are readily affordable. And here I am down in Melbourne in the High Performance Centre for the Rebel Women's Professional Rugby Team. And I'm giving a presentation on the importance of sports mouthguard hygiene and storage. And I'm sharing a US study of American football players that cultured the microbiota growing on their mouthguards. And they found over 350 different bacteria, as well over 100 different molds, one of which was actually a strain of penicillin. The bad news is that this strain of penicillin and a few of the other molds that are actually causative agents of asthma and necrotizing esophagitis. And not surprising, the study concluded that protective athletic mouth guards are contaminated by microorganisms that have the potential to produce oral and systemic diseases. They should be sanitized daily and changed when they become sharp or jagged. And a different study in the British Journal of Biomedical Science determined that denture plaque does actually differ from dental plaque and can contain higher levels of golden staph and Candida albicans. The study reported what we already know, and that is that inadequate denture hygiene increases the risk of dental caries, periodontal disease, and denture stomatitis. But the study also reported what we already have known for a few years as well, and that the microorganisms are implicated in endocarditis, aspiration pneumonia, and gastrointestinal infections, and that dentures act as a reservoir for these germs. And finally, effective oral hygiene is important to control denture biofilm and contributes to the control of associated oral and systemic diseases. Now let's have a look at an article in the BDJ that looked at an audit of denture cleanliness. 5 different cleanliness scores, 0, 1, 2, 3, 4, with 88% of dentures assessed landing in the 2 dirtiest levels. And a review of the clinical notes showed that 37% did not include any oral hygiene instruction, and that those with notes had no standardisation of advice given. And we will see a little later that this is actually a global problem. Backing up this audit is a report in the International Journal of Dental Hygiene that informs us that denture wearers' attitudes and habits do not conform to recommended guidelines. So we clearly are not getting the denture hygiene message across well enough. And I would add that it's the same for all removable appliances. But it did say that a combination of mechanical brushing plus chemical agents achieve the best results. And we'll be spending a lot more time on this later. So what were the habits and attitudes? Well, most people use a brush to clean their dentures, but some people only brush a couple of times a week, which scored very poorly on the cleanliness index, as you'd expect, while those who brushed their dentures 3 or 4 times a day showed excellent cleanliness. 30 to 60% brushed once a day. Only a quarter of denture wearers used a soaking tablet regularly, and over 50% left their dentures in at night, with females more likely to do the right thing. Now, this 2013 study of partial denture hygiene knowledge determined that there was no consensus on what level of denture hygiene knowledge should be expected, but that there was no legitimate reason for failing to deliver full instructions to your patients. This study also determined that when giving hygiene instructions just verbally, this was significantly less effective than verbal plus written instructions. So obviously, our patients do actually read our prepared handouts. The study also determined that although most dentists acknowledge aftercare was important, only 22% arranged a follow-up review appointment. Not surprising was the recommendation for regular dental exams, as this also presented an opportunity to reinforce the denture hygiene message. The study concluded that patients are confused and uninformed. And although the patient was responsible for maintaining oral and denture hygiene, it was clearly the obligation of the dental professional to educate and motivate. Certainly, this study suggests there is a lack of knowledge and awareness on denture hygiene among the individuals taking part in the audit, and that the dental professionals need to do better. And maybe, or rather probably, as dental professionals, we're also confused. And no wonder when we look at this Cochrane review, which determined that even with all of the extensive research conducted over many, many years, only a surprisingly small number of studies was found to be suitable for inclusion in this review, because all presented a high risk of bias, mainly due to problems associated with selective outcome reporting. So we really have to be careful when sorting through the dental research and the dental science. And that's why we will drift outside of the dental profession for some of our advice. And all of this has been confirmed more recently at the 2018 FDI World Congress in an address by the Foundation Chief Executive, Dr. Nigel Carter, that advised, people with dentures do not know how they should be cleaning them, and that with the variety of available information online, it is no surprise people are confused, and also that the amount of inconsistent and unproven advice about cleaning and maintaining dentures is frightening. He also reminds us that poor denture care and hygiene can pose a real threat to both oral health and general health. So maybe we do need to get back to basics. What materials are dental appliances actually made from? What materials are we trying to actually clean and store hygienically to benefit our patients? So let's start with our most common material, polymethyl methacrylate, or PMMA, which is also known outside of dentistry as plain old acrylic or acrylic glass or perspex. First developed by a couple of British chemists in the early 1930s, it starts as a petrochemical out of the ground, through a number of processes, moves to acetone, then methacrylate, and then synthesized into its polymer form. And this material is very, very tough. In fact, dental applications are only a small part of its story. PMMA has even been used for submarine periscopes and aircraft windscreens. And it was actually from this last application that the true nature of its biocompatibility was recognised when ophthalmologist Harold Ridley compared war pilot eye injuries from splintered windows of the Spitfire made from PWMA with splinters from the Hurricane, windscreens made from glass. The PWMA splinters caused scarcely any rejection. And in fact, Ridley took this knowledge and went on in late 1949 to implant the first intraocular lens made from Perspex. 1934, as best I can discover, was when the powder liquid acrylics, similar to today, started to be used for denture construction. Now let's move to the metal-based dentures and chrome cobalt. Again, a very strong and tough, and it's strong, tough, and biocompatible. And to highlight these characteristics, we can see that this metal is also used in joint replacements, but also jet engine components. Interestingly, a cobalt chrome heart valve was first implanted in 1960 and lasted over 30 years, proving its high wear resistance. Need to know also nickel is often added to improve ductility and help prevent fractures. But of course, we also need to be aware of then the potential nickel allergies. Then of course, we have wrought stainless steel clasps, which are corrosion resistant because they have an atomic level surface film that acts as a barrier. And this is due to the added chromium, about 10%, plus some nickel and a few other trace elements. Now, a very different material for the second most prevalent removable dental appliance after dentures, EVA, used to make sports mouth guards, and again, a material that is used far, far more in non-dental applications. EVA is most often used in footwear, floor coverings, and flexible hoses. EVA is ideal for contact sports guards. It's flexible, tough, crack resistant, and relatively easy to work with. But it does, however, come with some downside, and this is important for how we care for these sports guards. It is sensitive to heat. It does have poor resistance to abrasion and tearing, so no cleaning with toothpaste or any type of hard brush, and storage needs to be protective and at room temperature. This close-up vision of EVA shows the irregular surface, and clearly simply rinsing or even brushing on its own is not going to be effective. We need a cleaning agent, like soap, that works with soft mechanical brushing to disturb the biofilm before it's rinsed away with fresh water. Just look at the mold collecting on the right. And we really do need to take this mold issue on mouth guards a lot more seriously than we do. Here we look at a working group put together in the US in 2006 to come up with guidelines on how to deal with mold after severe storms and hurricanes. The National Centre for Infectious Disease, the National Centre for Environmental Health, and the National Institute for Occupational Health and Safety, all put together. Clearly, the US government is taking mold very seriously as a health risk. And it determined molds need moisture and nutrients to grow. Damp, warm environments are best. Well, sounds a lot like the mouth, doesn't it? And it's also the number one factor that limits growth of mold indoors is a lack of moisture. And that's a big thumbs up to dry storage for all dental appliances, not just sports mouth guards. And the group looked at factors that cause disease from mold. Inhalation is the most important mechanism, and then comes skin contact and ingestion. Clearly, mold growing on dental appliances raises red flags for all three, especially as the mouth is the gateway to the lungs and the gut. Also noted was that repeated exposure can sensitize people who can then experience hay fever symptoms and even asthma. And then expert advice on how to prevent molds. Well, wash surfaces with soap and water, disinfect with a mild bleach, and then allow to air dry. Additionally, and this could be funny if it wasn't so serious, people doing the cleaning of the floors and the walls should be wearing rubber boots and gloves and goggles, which is probably a bit of an overkill when washing your dental appliances, but it's certainly an indication we need to take this issue far more seriously. Embarrassingly, even the American Home Brewers Forum takes this issue more seriously with EVA tubes than we do sports mouth guards. They're all over the issue of preventing mold in their tubes so the beer remains uncontaminated. Happily though, a separate report showed that mold doesn't affect the physical or protective properties of EVA. Now let's turn our attention to aligners, which are made from a few different materials, but one popular setup is a bilaminate of polyurethane and copolyester. Polyurethane is an interesting material, very, very hard and very smooth and scratch resistant, and it's most used on the soles of shoes, floor coatings, and car parts. The other layer is copolyester, which we understand from outside the dental world has a high resistance to shrinking, most chemicals, abrasion, and moths. So what is the difference between copolyester and plain old polyester? Well, let's get an explanation from the Tennis Reviewer website, which explains that copoly is simply polyester with a few extra chemicals, and it's often preferred for tennis strings because straight polyester strings snap back quickly into place, achieving maximum topspin and more control. However, this snap significantly increases the incidence of tennis elbow. Copoly is still tough, but has less snap and therefore less tennis elbow. How do they clean polyester? Well, the clothing industry says warm water and detergent, and the furniture industry recommends a damp cloth, soap, and water for polyurethane coatings. Okay, nylon, becoming very popular and is also an amazing tough material. Another synthetic fibre that comes from petrochemicals, and we learned from the American Oil and Gas Society that it was first developed by DuPont in 1935. One of its first uses was to replace hog bristle toothbrushes with nylon. So, thank goodness for that. American journalist Shannon Corbell wrote an interesting article in 2020 with the shocking title, Nylon, the reason we won the war and started shaving our legs. She describes how in the 1930s, the United States imported 4/5 of the world's silk and 90% of it came from Japan. 75 to 80% of that was used for women's silk stockings. Unfortunately, these stockings didn't stretch. They were delicate and ripped easily. Then along came DuPont, who immediately recognized the opportunity for nylon stockings, which were an immediate hit. All 4,000 pairs sold within 3 hours at their experimental debut. The next year, 4 million pairs were sold within 2 days. But then came a long war. The nylon was diverted to the military because of its strong and tough and durable. The women sadly missed their stockings and so started to do the next best thing. They shaved their legs and applied a type of paint. A bold new revolution was happening as hair removal to mimic the appearance of stockings, and this trend continues today, inflamed by the beauty industry, we're told. Miss Corbell does reassure us, though, that stockings made a comeback. And cleaning recommendations for nylon outside of dentistry: cold water, never use bleach, drip dry. So when our patients go looking for information on dental appliance hygiene, what they did or did not receive or forgot they received, what are they learning online from the dental industry? And a warning, this is where things really do start to get a bit messed up. One of the very first information sources that comes up if you Google, how do I clean my dentures, is from the otherwise very well respected Mayo Clinic, which advises correctly to remove dentures from the mouth. So clearly some patients aren't even hearing or understanding that message. Important to protect against dropping with a towel or water in the sink, soft brush, non-abrasive denture cleaner, then soak the dentures with water or a mild soaking solution overnight to stop dentures drying out and losing their shape. And of course, rinse dentures very thoroughly in the morning, as these soaking solutions are toxic and can cause vomiting, pain or burns if swallowed, which is possibly why some people are avoiding them. Coming up second was advice from everydayhealth.com, the standard warning for a towel or water in the basin, which is actually really important because we see every day in general practice broken and chipped dentures and splints from dropping. You can use a nail brush, they say, with salt or baking soda, or you can simply brush the dentures with hand soap or dishwashing liquid. I do like the idea of soap, and we'll look at the science behind this a little later. A very quick note on the nail brush idea, and you'll hear this a little bit. I'm not a fan. It's okay for most lower full dentures, but for me, it doesn't get down into the undercuts and tooth indentations for most other appliances very well. And the bristles tend to grab at the metal clasps. But I suggest you try it yourself if you're supporting this recommendation. We do have this added recommendation that when nothing else is available, then you can use free air, as oxygen can kill yeast and many other bacteria, and therefore leaving your dentures on a dry surface overnight can help disinfect them. It's a misconception that dentures need to be stored in water, it says. So already we have mixed messaging in the first couple of most popular Google searches, and then close behind comes healthline.com. And we are back to soaking to prevent warping, although wisely warning the patient not to put their dentures in boiling water. Let's now move to the Invisalign website for aligners, and I'm happy to report this is a far more thorough and no doubt researched, tested, and we see their cleaning system crystals contain soap, which we will see later is very good. It relies on dissolving these crystals in water in a container and then shaking. Leave it sit for 15 plus minutes, then shake again for 20 seconds before rinsing thoroughly with warm water. Next up for aligners, in Australia at least, is Orthodontics Australia, which recommends a gentle antibacterial soap or dishwashing liquid. Use a spare toothbrush to mechanically disturb the biofilm, and then of course to rinse thoroughly. You can use denture cleaning tablets as directed also, and at the very least, rinse your aligners under warm water twice a day when you brush your teeth. Let's now move to what our patients will find on our professional body websites. The Australian Dental Association on denture hygiene says brush twice a day with soap, soak dentures daily, leave dentures out at night, store dry, regular checkups. The Australian Dental Association on sports mouthguard hygiene. Wash them with soap and cold water or lukewarm water. Clean the inner surface with a soft toothbrush or nail brush after wearing. Well, good luck getting the nail brush down in there. But then store in a clean, rigid and ventilated plastic container and keep away from sunlight and heat. The American Dental Association website advises rinse food particles and remove denture adhesive. Doesn't say how. Soak as per manufacturer's instructions. Cleaning pastes and gels should be brushed on and rinsed off. Store in water so as to retain shape and keep it from drying out. Dentures can be cleaned with toothpaste or soapy warm water and a soft bristle brush. The Canadian Dental Association is quite brief, but yes, dentures can collect plaque and tartar, take them out at night, soak them overnight in a special denture cleaner or in warm water, and vinegar, half and half, but not if it has metal clasps. Use warm water only, which will loosen the plaque and the calculus. And we do know the old home remedy to use vinegar, and this is because of it's very acidic, around a pH of 3, and hence it needs watering down, and it works because anything under a pH of 5.6 will dissolve calculus. And that's good, except if you've ever tried it, and I have with my night guard, everything tastes like vinegar and smells like vinegar for a week or two. Later, we will introduce you to the Dental Fresh with a very gentle pH of 5.0, which will also dissolve and prevent calculus and leave your appliance fresh and smelling like peppermint. 2018 Global Task Force advises daily cleaning with a mechanical action using a toothbrush or denture brush, non-abrasive denture cleaner, daily soaking, leave dentures out at night. Soaking in a denture cleanser solution after mechanical cleaning seems to be beneficial for preventing denture stomatitis and the potential risk of pneumonia for the frail and institutionalized. A recall and maintenance program is important. So now let's look at some of the science and the research. What do the therapeutic guidelines have to say about denture care? So it was mentioned quite a few times, but how does it actually work? And why is this important? And what does the science also say about brushing, soaking, and storage, wet versus dry? So the therapeutic guidelines are compiled by real experts in their field and are fiercely independent. So if you don't mind, I'm actually going to read this out verbatim, as it's all good stuff. Dentures should be regularly cleaned twice a day to remove food particles and plaque. Advise patients to remove dentures from the mouth and clean them with warm water, mild soap and a toothbrush, denture brush or soft nail brush. Avoid cleaning dentures with hot water, toothpaste, kitchen detergent, laundry bleaches, methylated spirits, antiseptics or abrasives, unless instructed by a dental practitioner. Patients should clean their gums and remaining teeth with a soft toothbrush and toothpaste. Advise patients to place dentures in a dry environment overnight after cleaning them. Traditionally, it was recommended that dentures were kept in liquid overnight. However, allowing the cleaned denture to dry out at night is more effective for reducing yeast colonization and plaque accumulation, compared with both denture cleansers and water. Although repeated cycles of hydration and dehydration can change the shape of the denture, these changes are very small and clinically insignificant, not clinically significant. Then it highlights dentures should be cleaned, then placed in a dry environment at night. If there is a buildup of hard deposits, tartar or calculus, dentures can be soaked overnight in a solution of white vinegar, diluted 1:4, then cleaned as usual. Advise patients to see their dentist or professional for professional cleaning if deposits can't be removed. And then a note on denture stomatitis is prevented by regularly cleaning of the dentures and storing them dry overnight. Advise patients with denture-associated stomatitis to optimise denture hygiene and let them know it can take a month for symptoms to improve. So we've heard the recommendation from the experts and the science. This is how soap actually works. The soap molecules have a tail which is attracted to the dirt and all the other little things that collect and grow on your removable appliances. And the polar end, or the head end, is soluble in water and will lift the dirt away when we rinse it with the fresh water, which personally I think is pretty jolly good and certainly easy for our patients to understand. Okay, so what are some of our brush-on soap options? Well, Curaprox have their daily denture gel and Sterident has the denture paste, both of which have SLS or sodium lauryl sulfate, which is actually just a type of soap. The Sterident denture paste can also be used for natural teeth, the packet says, and it does contain some titanium dioxide, so it sounds a fair bit like toothpaste. And then we have Dr. Mark's Dental Fresh, which contains a soap molecule derived from coconut and corn, not SLS. A little more on Dental Fresh. We've actually targeted dental appliances specifically by adjusting the pH to a mild 5.0, which is about the same as a banana, but more importantly, is well below the critical 5.6 required to dissolve calculus or tartar. Ideally, patients start with using Dental Fresh on the day their dental appliance is fitted, and this will help prevent stains or calculus developing in the first place. And, you know, we much prefer and advocate for a preventive care approach, but the above before and after photos show what we call an appliance rescue, which we can achieve for a neglected appliance with regular twice daily Dental Fresh over a week or two. And you can let the foam and the soap suds sit a little longer in such cases before rinsing off. We've also added a surfactant to promote rapid drying and pure peppermint oil for its mild antibacterial property. But also the appliance is not just, so therefore the appliance is not just left sparkling clean, but also smelling nice and fresh. Dental Fresh is also good for your tooth whitening trays, gets all the used gel out, just a slow, gentle action with the brush. And if you like, you can leave the soap suds sit on there a little bit longer before rinsing off with fresh water. Okay, so now we've got a good idea about dental soap options. Let's take a look at dental specific brush options. Well, the old brush options haven't really changed, as I mentioned in the introduction, in 50 years, and they're really just a modified toothbrush, which we know has a small head and a long handle, which is perfect for cleaning teeth inside the mouth, but we're not cleaning our appliances inside the mouth. We're washing them outside the mouth. Held in our fingers over a sink or basin, the first thing you'll notice about the Sure grip is that the bristles are quite soft, but very, very tough. And the telescopic tips are engineered and measured to bend and fit and squeeze into every little space or tooth indentation and around the undercuts and clasps to disturb the biofilm as they wash and polish the appliance. And I can tell you from my personal experience, it'll leave your sparkling clean, but also gentle enough to wash your tooth whitening stents. And it also covers a lot more surface area than a toothbrush, so therefore it's far more time efficient. The handle is also fashioned on your typical doorknob and therefore more ergonomic, hence the name Sure Grip, and can be used in a rotary polishing action and not just your back and forward action. And truth be told, I mean, a toothbrush will actually work if a person sits there and cleans it diligently, but they tend to just sort of waft it over the appliance and it doesn't really cover all the surfaces. With the Sure Grip, you can waft it over the surface and pretty much get every corner. And we do need to mention there is this universal warning to lay down a towel, a protective towel, or half fill a basin in case you drop your appliance. Every website says it. And we know people do drop their appliances, but you wonder how many patients actually follow this advice. And this was one of the very early driving factors for me to develop the hygienic. I wanted to lock in the appliance so it couldn't be dropped during the daily plaque control. And this is what it looks like pulled apart. And you can see 5 brushes on the top and 5 on the bottom, all work on your dental appliance simultaneously inside this ventilated protective casing. It also comes with a replacement brushes, which we recommend are flipped every 3 to 4 months, the same as you'd recommend changing your toothbrush. So if you determine that protected washing is clinically indicated for your patient, or there is a history of dropping and breaking, if you're worried that they're going to drop their appliance, then hygiene should be considered as certainly as a viable recommendation, which pretty much is for most patients. I thought it was important to acknowledge this very interesting 2014 study that showed much higher levels of candida growing on the fingertips of people who had denture stomatitis. And this led to a recommendation that patients with removable dental appliances should be further informed as to the importance of proper denture hygiene and personal hygiene and the link between the two, contamination of the hands and other parts of the body. And clearly this represents another indication to consider hygiene where the dental appliance isn't held in the hand at all. Back to the science again, and this 2016 study looked at ultrasonic versus mechanical brushing and determined that neither system actually removed all the plaque completely, and that the results for both were similar. Porosities in the denture resin contributed to this result. And this French study, 2011 in Paris, shows improved denture hygiene over a 2-week period with supervised denture hygiene. Excuse me, but we can see on the bottom images that some biofilm still remains. So this tells us more is needed than simply brushing with soap or toothpaste. And that more turns out to be dry storage and some level of intermittent soaking with an antibacterial solution, as we will soon learn. However, the next step in our process is to look at denture adhesives. And we again rely on the GSK-funded task force and Oral Health Foundation. It concluded, quite sensibly, that the dental professionals should instruct their patients on its correct use and on removing it daily, remove the adhesive daily and cleaning the denture. Pastes and gels work better than denture strips, and that unfortunately none of the cleaning techniques recommended by the manufacturers was completely effective. The task force also recommended applying the adhesive creams to an already clean and dry denture. Before sleep, the denture should be removed and both the denture and oral cavity should be cleaned of any remaining adhesive. Quick note on soft linings, reported in this Dental Update 2019, rinse dentures after each meal, soft brush and soak in an alkaline hypochlorite solution for 10 minutes and then store dry. Okay, now a study that looked at mechanical brushing and wet storage with a soaking tablet in a Belgian aged care or long-term care facility. The results showed basically a reduction in bacteria, but no effect on Candida albicans. Let's now have a look at a study of 30 fully edentulous patients in Japan. In this study, the combination of brushing with water and then soaking in saline versus the same brushing but soaking in a denture cleanser, in this case Polydent Fresh Cleanse, which is a peroxide-based product and also contains a detergent. The second method was proven superior, but look at the brushing time, 2 minutes a day for every patient for 3 weeks. I'm not sure even the most compliant patient would brush their denture for 2 minutes, but it did prove the soaking in Polydent did improve the outcome. And here are some soaking options available. Do your research and at least pick one and promote it to your patients. There's a few to choose from. This paper determined that hypochlorite solution of 0.5% for 10 minutes was the best to actually remove biofilm, but also reported an alkaline peroxide solution must be immersed for 30 minutes to produce a cleansing effect similar to simply brushing with soap and water. Just rinsing under the tap is useless, as you would expect, and I would suggest it's the same for all dental appliances. We by now understand the importance of at least intermittent soaking of dental appliances in an antibacterial solution of some kind, but we really do also need to touch on and acknowledge the very real dangers of these serious chemicals. When recommending, it's incumbent on you and me to warn of the dangers. Mayo Clinic and the FDA both warn that if not rinsed off completely, then there is potential damage to the esophagus, abdominal pain, burns, breathing problems, low blood pressure, seizures, bleaching of tissues, internal bleeding, or vomiting. And the globally respected Knowledge Oral Health Care, and I agree, discourage soaking tablets in dementia situations. And I would add, this is not just aged care. You will need to keep them locked away at home. And you can see this very sad article when a soaking tablet was swallowed by a gentleman who was suffering dementia. And this very recent 2021 independent study really shocked me when it tested the effect on the surface roughening of popular soaking solutions on acrylic when used as per manufacturer's protocol. From these images, we can see clearly the hypochlorite is the most aggressive in attacking the surface of your appliance. But fair to say that all the chemicals tested will affect the surface roughness to some degree. So we must keep this in mind and make sure our patients don't oversoak. So let's road test the most popular brands, actually all a little different. I strongly recommend you test these yourself, but especially if you provide splint therapy or aligners. Actually, they are all quite pleasant and close to a neutral pH. The photo on the right is my dad, age 91, and he gives the thumbs up to the Curaprox weekly soak with eucalyptus. Soaking vessels, well, take your pick. I will point out that the Hygienic comes with its own travel case, which also acts as a soaking vessel, and you can see the watermark on its side. Now, dry storage still seems to be a confusing issue for some, so let's take a look at some of the old and new science. Way back in 1986 and reported in J-Dent, it was also a subject often ignored, but the question was asked regarding dry or wet storage and possible dimensional change. The result, it was proven that dry storage did actually kill Candida and that dimensional change was insignificant. Of course, this would also be a relief to the people in their submarine with their periscopes. And this is backed up more recently by this 2020 Canadian study that looked at overnight storage. It concluded that cleaning and dry storage are best. However, if there's no hygiene at all, then soaking in an alkaline solution should be considered, or just plain dry storage on its own. It did show that simply storing in water may actually promote oral thrush. and further supported again by this 2020 study reported in the Journal of Gerontology, clean dentures twice a day and store dry. And to highlight the need to leave dentures out at night, let's look at this study in Japan and reported in JDent that advises that wearing a denture during the night literally doubles the chances of pneumonia for our elderly. Proper storage is also very important for sports mouthguards. This article in the International Journal of Oral Science showed that after brushing and rinsing, no bacteria were detected when stored for 2 days or longer in a ventilated environment. But when stored in a closed container, bacteria were detected for up to 14 days. So given the importance of storage, let's now move in that direction. I totally get these are a cheap option, but they have, zero ventilation or near zero ventilation, and they are perfect for incubating mold. Safe, dry, ventilated storage is critical so that we don't undo the hygiene thread by storing our appliance in a cesspool. And here are 2 purpose-designed options in the Dr. Mark's range. After washing your appliance in the hygienic and rinsing off, simply set and forget, as it all self-dries and also provides protected and ventilated storage. We also have the cage on the right for your sports mouthguard, and it can hook onto the side of your backpack or sports bag. Of course, the cage can be used for all other appliances as well. So now, we've heard from the real experts and looked at the science. We can now pull all these threads together and determine how to deliver oral hygiene instruction chairside so our patients can connect with our message, which is easy to understand and is affordable. Discuss with your patient, firstly, mechanical biofilm disruption with a soft brush. All surfaces twice a day using a soap-based gel and rinsing with fresh water. If not using hygiene, then of course there is a need to lay down a towel or put a few inches of water in the basin. Soak at least a couple of times per week with one of the antibacterial solutions for between 10 and 30 minutes. And again, very important to rinse thoroughly and then dry ventilated safe storage. And have some written instructions prepared as a handout and remind patients or the parent of the patient to bring their appliance to every recall visit. Now, what does that look like? Well, important to show and tell with your patient's chairside. Mechanical brushing twice a day with a soft, flexible, but tough brush, one of these, using a soap-based product and fresh running water, not toothpaste. Soak at least twice a week for 15 to 30 minutes with one of these or as directed by the manufacturer. Then dry, safe, ventilated storage is so important. Now, sports mouthguard hygiene, and start with the transport to and from the game. And a product I haven't talked about yet is Quick Clean. In essence, it's a pre-wash sanitizing spray to use immediately after the game and before your guard goes back into the cage. It contains a wetting agent to stop the saliva and dirt and any other, yuckies from drying out and becoming all crusty, as well as having a mild sanitizing effect. It has a pH of 6.2, which is the same as many of the dry mouth gels and sprays. And when you get home after the game, we now need to give your sports guard the full treatment with mechanical brushing, ideally with Hygienic Sport to cover all surfaces every time, but you can use the Sure Grip. Applying the soap-based Dental Fresh, rinse with fresh water, and of course, dry storage. And again, after discussing and demonstrating this hygiene routine, have some written instructions prepared as a handout and remind the patient or the parent of the patient to bring their sports mouthguard to every recall visit. And please, our products are not just for high performance professional athletes, they're for everyone, the young and the old. So in conclusion, please let's step up and incorporate best practice hygiene instructions for all removable dental appliances, certainly when we issue them, and then again at every recall visit within your existing preventive care and active maintenance programs.